Good morning, everyone, and welcome to our webinar titled Navigating Employer Minefields. I'm Chuck Tapert, President of StoneTapert Insurance Services, and I am delighted to introduce our all-star panel of experts, which includes Cindy Flynn, employment attorney with Heckler, Flynn & Associates, Dr. Susan Levy, HR account manager with HR Biz, and Lajoie McClendon, Chief Operating Officer with StoneTapert Insurance Services. Our panel will be covering topics that include the Family First Coronavirus Response Act, essential versus non-essential companies, exempt and non-exempt employees, paid sick leave and FMLA, furloughs versus layoffs, assessing risk, premium contributions for furloughed employees, ACA Lookback measurement method and COVID-19, and benefits waiting period for rehires. Please feel free to type in questions if you have them. If we can't answer them on the spot, the speakers will contact you with the answers and supporting information. Our first speaker is Dr. Susan Levy, and Dr. Susan Levy received her doctorate in psychology and organizational management, holds her PHR certification, and has many years of experience in the human resources industry. As an HR consultant at HR Biz, Susan oversees various HR needs, including development of onboarding materials, tracking up-to-date labor codes, employee discipline, harassment prevention training, engaging employees in interactive processes, overseeing harassment and other workplace investigations, safety in the workplace, human resource information systems, development and execution, and much more. Susan focuses on implementing or adapting HR policies through promoting employee engagement and minimizing disruption to the organizational culture. Ladies and gentlemen, I present Dr. Susan Levy.
Thank you so much, Chuck. So as Chuck mentioned, my name is Susan. I am going to first start us off by going over the FFC RA, which is the Family's First Coronavirus Response Act. You are probably semi-familiar with it, but we found that there are a few different caveats that people might not be aware of, and we wanted to highlight. So just as an overview, this was passed back in March, and it applies to any employers with less than 500 employees. The FFC RA provides paid sick leave and expanded paid FMLA for COVID-related situations, which we'll discuss. The timeline that it covers is anytime between April 1st and December 31st of this year. So if you have a qualifying reason or your employee has a qualifying reason during this period of time, they would be covered. And the wage is paid by the employer, but then you receive a tax credit to offset the cost. So what are the different reasons for the FFC RA covered leave? Well, first is the employee is subject to a federal, state, or local quarantine or is in an isolation order related to COVID. Now, one of the biggest questions I get with this is the California or Los Angeles County stay-at-home orders or safe-at-home orders, can I count that as number one? The DOL has made it clear that those orders do not qualify. So then what would qualify? Well, the CDC and federal orders, if you've traveled internationally to quarantine for 14 days, that would qualify. For a while, if you traveled to New York City and needed to quarantine for 14 days, there was a federal order for that. But general stay-at-home orders do not. Other reasons are if an employee has been advised by a healthcare provider to self-quarantine, if the employee is experiencing symptoms and seeking a diagnosis for COVID, if the employee is caring for an individual who is either ordered to self-quarantine by a physician or by a federal, state, or local quarantine order. If the employee is caring for a child whose school or place of childcare is closed due to COVID, or this general catch-all if the employee has a similar condition as specified by the U.S. Department of Health and Human Services. I have yet to run into an employee that could be classified as reason 6. Usually if they're having the symptoms, they are seeking diagnosis and it can be number 3, but they kind of have a catch-all just in case. So what are the durations of leave? So if you have reasons 1 through 4, so if you're in a order to quarantine, your doctor's recommended, if you're caring for someone who's quarantined, if you're having symptoms, all of that is up to 80 hours of leave if the employee is full-time, or if they're part-time, whatever their 2-week average work is. The large amount of leave goes to if they have childcare issues. So if there's no school, which is pretty much every school in the state, and there's no childcare available, they can get up to 12 weeks of leave. So that is considered 2 weeks of paid sick leave and 10 weeks of expanded FMLA. If the person's full-time, that's 40 hours a week. If they're part-time, it's their average work week. So how much does it pay? The easy way to think about this is if it has to do with the employee themselves, it pays 100% of their wages, up to $511 per day, $5,110 total. So if they have the symptoms, if they're under quarantine, if they're seeking medical diagnosis, 100%. If it's to take care of someone else, because their child doesn't have childcare, having to do with someone else, it pays 2/3 of their rate, up to $200 per day, $2,000 total for the sick leave, the 2 weeks of sick leave, and then $10,000 extra for the extra 10 weeks of childcare. A lot of you might be thinking, wow, 12 weeks off for my employees, that would be, honestly, it could make or break our company. Which is why there is an exemption for employers with less than 50 employees. The federal government did realize that that would be a big undertaking for small employers. They've left an exemption window that if you have less than 50 employees and you can show that this would cause financial obligations that you could not meet, that the employee being absent would be a huge risk to your operation, or that you can't find other workers to replace them during that time who are qualified to do the job, you can document it and exempt yourself only from the child care portion. So only reason number 5. So if you are exempt from this and you believe that you can show that you can meet these exemption reasons, you need to document why you're denying it and keep that documentation on hand for 4 years. You don't have to do anything with the documentation unless you're audited, but the DOL has made it clear that you need to keep those records in case they decide to go back and audit people. We honestly don't know which way things are gonna go. Part of, a lot of people are like, oh, they're probably not gonna audit anything, but it's better safe to have it because you don't wanna not have those records and then, have an issue later. So documentation requirements is another big one that is important. Similar to documentation if you are exempt from the childcare portion of the FFC RA, this other documentation for any other reason, you do need to keep for 4 years as well. So all documentation needs to include the employee's name, the date for which the leave is requested, the qualifying reason for the leave, and a statement that the employee is unable to work or telework because of the COVID-19 qualifying reason. We recommend having this in an easy form that you can have the employee fill out so that you don't have to remember each portion every time. If you need a form, you can contact us after and we're happy to provide one for you guys to use. In addition to the general documentation requirements, each specific reason has a little extra that you have to add depending on what the reason is. So if it's the first reason that there's a federal government order that the person has to quarantine, they have to provide what the name of the government entity is that issued the order. If they're waiting for medical diagnosis or they've been told by their healthcare provider to quarantine, they need to provide the name of their healthcare provider. If it's related to caring for someone else who is under quarantine or has a medical diagnosis, they have to fill out a similar form that, like they would fill out for the FMLA medical certification form, that's filled out by the physician for the person they're caring for, documenting that they are caring for this person and this is what's going on with that person. And lastly, if the person is caring for their child who has a closed school or childcare, they have to include the name of the child or children, the name of the school or childcare that's unavailable, and a statement saying that there's no other person that can care for that child during the period of requested leave. So there's a lot that gets said about the covered wages and paid sick leave, but not as much has been out there about how you can actually qualify for reimbursement for the cost to the employer for a health plan while the employee is out on FFC RA. So this is really important because it's an extra little bit of credit that you can get back on taxes, and it can really make a difference for a lot of employers. So if you have a health plan that's qualified, so it could be a medical plan, dental plan, vision plan, flexible spending account, any of those, and you have your employer portion of that can be used as a payroll tax credit. So to figure out how much that is, you need to figure out what the daily cost for that health plan for that employee who's on FFC RA leave is to the employer. So if, let's say, the employee, if the cost to the employer is $13,000 per year, you would divide that amount by 260 work days. That's $50 per work day that it costs the employer. And then however many days they're out on FFC RA, whether that's 2 weeks or even 12 weeks, you would multiply those days by the cost per day and you can get a tax credit for that amount. So that can end up being pretty substantial. If someone's out for 10 days, that could be a $500 tax credit if your daily cost is $50. So a little bit about the tax credits. There's more information on the IRS site, or you can reach out to us. We're happy to assist. If you're using a payroll system like Paylocity, ADP, Paychex, most of them have a system in place that will track this for you. So if you're not aware of how your payroll is set up, I recommend reaching out to your account manager so that they can explain how it's set up. If you do payroll in-house, it might be a little more labor intensive, but definitely not impossible. Basically, you're entitled to the full credit of wages, whether it's the 100% or you're only paying them out 2/3. You're not required to make up that difference for 2/3. And the tax credits are on things like the Social Security tax, Medicare tax. Basically, you get to retain the federal income taxes, the employee's portion and the employer's portion, to make up whatever cost you paid out. So whatever cost you paid out in those wages or whatever cost you paid out in the qualifying health plans. If for some reason your tax does not cover the cost, you can file with the IRS for a payment to make up for the difference. They said that will be out this month. They have not yet released how we're going to do that. A couple more days left in the month, so we'll continue to keep an eye out and send updates with that. So that was a little bit about FFC RA. Now I just wanted to highlight the essential versus non-essential workers. I know there's still a lot of debate on who's considered what and how it goes. So there's the California Safe at Home, and then there's the Los Angeles Safer at Home. So the Safe at Home for California, that follows the federal critical workers list. In that order, it refers directly to the federal essential critical infrastructure worker list. So anytime that list changes, it automatically changes for California. So we've included in the bottom of this slide, which we'll send out to you, the link so that you can check. The last update was on 4/17. So the feds are ongoing looking at different industries to see if more can be added in as considered essential, basically when they push and say, hey, don't forget about us, we're important, please list us at essential, and then the feds will go in and update it. Currently, there's 16 sectors on there. That is different than the Los Angeles Safer at Home, which is similar in some ways, but specifically lists things out in their order. They do have the right to update their order as well, but it's not happening on the same sense as the federal level is. As I mentioned before, none of these orders qualify someone automatically for FFC RA. If you are considered essential, you have to make sure that your employees are complying with the social distancing, that you're sanitizing spaces. Some locations are required to wear masks. Make sure that you're doing all of that every day, because even if you're essential, if you're not having these policies in place, the government can still come in and say, hey, we don't want you to operate if you can't follow those. You also want to make sure you have signage to inform employees and the public that they cannot enter if they're experiencing any symptoms. And lastly, to highlight, had you asked us 6 months ago if you could check employee temperatures, we'd say definitely do not. But now the EEOC has said that you are allowed to check employee temperatures at the beginning of each shift. If that's something that you decide to implement, you should do it for all employees and be consistent with it. And ideally, they say you should check them outside or somewhere, because if they really are symptomatic or have temperatures, you don't want them in the facility. So you don't want them coming in and starting the work and then checking. So some have set up desks right when you first enter or right outside of where you enter. So that goes over essential, non-essential, and now I'm going to pass it on to Cindy.
Thank you, Susan. Our next panel expert is Cindy Flynn. Cynthia Heckler Flynn is the founder and managing partner of Heckler, Flynn & Associates, a Southern California-based employment defense law firm. Since starting her practice, she has grown the firm to 5 associates and 4 support staff. The law firm's focus is employment law, where their mission is to protect and defend entrepreneurs and business owners. Cynthia has been voted as a super lawyer every year since 2017, and for the last 2 years has been named as a Pasadena top attorney. Ladies and gentlemen, I present Cindy Flynn.
And thanks so much, Chuck. So I'm so excited to be here today. As a kid, my parents ran a printing company, and I got to see firsthand what it was like to run a business, and more importantly, what it was like to have employees. And I just watched them through the years, and one employment issue after another would come up, and it really tore my parents apart. And so after years of marriage and running a business together, they unfortunately ended in bankruptcy and divorce. But I knew early on I wanted to be an employment lawyer, really protecting and defending business owners. So, and with COVID-19, over the last several weeks, we've seen a huge rise in clients getting demand letters. So our whole mission is very in line with HR Biz and StoneTapert in just getting out as much information as we can to protect our clients and our business owners. So a couple things we wanted to go over today. I know Chuck mentioned that. Because I am a lawyer, I have to give you guys a disclaimer that content on this webinar should not be considered legal advice and is for informational purposes only. And you can read the rest of the disclaimer. But some employee risk categories. So OSHA promulgated guidelines which identify employee risk categories. And this is for businesses that have remained open since they are part of the critical sector that Susan just talked about, or for when the stay-at-home order is lifted. And OSHA identifies it into 3 different categories. For healthcare workers and healthcare support, they are considered the high-risk categories. Employees with high frequency contact with the general public, such as school staff, those working in high volume retail, or those working in high population density workplaces constitute that medium exposure. And then employees with minimum occupational contact with the general public, or coworkers such as your office employees or remote workers, those constitute the lower exposure risk group. So employee categories to assess risk and determine next steps, those employees who are returning from affected areas, those in close contact with those returning from affected areas, those who've obviously tested positive for COVID-19 themselves, and then those showing signs or symptoms. So this isn't too much of an issue these days because of all the travel bans that have been going on lately, but if you have an employee returning from an affected area, they are required to self-quarantine for 14 days. They might be required to undergo mandatory health screenings by federal, state, or local authorities. And then as an employer, you can require a medical release to return to work for these employees. And you may want to maintain a high level of alert with regard to them. Employees in close contact with individuals returning from affected areas, they may be required to self-quarantine as well. And then also as an employer, you can require a medical release for them to return to work as well, and continue to maintain like a high level of alert with regard to those employees. For employees who've tested positive, and truly it's not a matter of if an employee tests positive, it's a matter of when. And we recently just developed this whole, kind of like a 4-page PDF. If anyone wants it, I'm happy to send it to you. You just have to email me. My email address is at the bottom, and it's an action plan of what happens when an employee does test positive. So bottom line is you immediately want to send them home or have them stay at home. You immediately want to treat the affected area in which the employee worked as per CDC. They have recommendations and guidelines on their website. You want to advise the employee and or customers who were in contact with the affected employee and offer reimbursement for medical testing for these employees. It's really important though to not identify the employee by name. That is a privacy concern. So you don't want to say who the person is that tests positive, but you might be required to pass out workers' compensation paperwork if applicable, and then also contact the CDC or local health department. Employees who show symptoms, you may send the employee home upon observation of symptoms consistent with COVID-19. You can require a medical release for these employees to return to work as well. Immediately treat the affected area again in which the employee worked per CDC, and then you may advise customers and or other employees who are in contact with the affected employee. Again, do not identify the employee by name. Emphasize that there's been no diagnosis, but that you're acting in an abundance of caution. So in order to assess the risk, you may ask your employees to inform you if they have come into contact with someone diagnosed with COVID-19. You can ask them to inform you if they have symptoms of the virus or have been diagnosed with COVID-19, or inform you if they have recent travel to highly affected areas. You may not, however, target individual employees unless you have an objective basis for asking. And this is where we're going to see a rise in probably age discrimination lawsuits within the next year. We represent only the best, good-hearted employers out there. And we've had some come to us and say, oh, I sent all my staff over 60 home. And I'm like, no, that's age discrimination. So keep that in mind. I know we all have good hearts and we're trying to protect our employees as best we can, but you cannot use age as a factor. So, so again, just do not target an individual employee unless you have an objective basis for asking. And then keep in mind, you cannot ask about any other medical condition or underlying medical disability or any information on that regard. So for your non-exempt employees, Non-exempt employees sent home during a workday must be paid reporting time pay unless state of emergency includes a recommendation to cease operations. Exempt employees must be paid their full salary for any week in which they perform work. And you can offer telework or remote work if it's administratively feasible, making sure that non-exempt employees have the ability to track time worked as well as meal and rest periods. And then you can also require a leave of absence if telework is not feasible. Just one note here, reporting time pay does not apply when operations cannot commence or continue when recommended by civil authorities. This means that reporting time pay does apply under a state of emergency unless a state of emergency includes a recommendation to cease operations. So you can, as an employer, require an employee to use accrued paid time off or vacation time. You cannot require your employees to use paid sick leave. So with reducing hours, you can temporarily reduce employee hours. This must be done in advance. Employees are eligible for partial or complete unemployment benefits if there's a reduction in hours, whether this is partial or total, whether it's permanent or temporary. And if a business operations cease, non-exempt employees are only entitled to hours actually worked and accrued unused vacation, unless reporting time pay applies. And then for your exempt employees, they are entitled to their full salary in any week in which they work. If they do not work, then they can use accrued unused vacation. And that's really important to note because we're still getting questions from clients as of last week of they want to check in with their staff that haven't worked in a couple weeks because they were shut down, and they want to see where things are. And even if it's a 15-minute check-in conversation, you need to pay those exempt employees their full salary that week. So keep that in mind as you start to reach out to your employees and hopefully start to open up again. So both a layoff and a furlough, assuming eligibility requirements are met, would entitle your employees to receive unemployment benefits. A layoff can be temporary or permanent. A furlough involves reducing the days or weeks that an employee may work. And the Department of Labor, the Division of Labor Standards Enforcement, the DLSE, has recently said for purposes of timing a last paycheck, there is no difference between a furlough that's longer than 10 days and a layoff. So keep that in mind. I believe that due to this unprecedented situation, it's unlikely an employer will face liability for failure to pay accrued and unused time off at the time of the furlough. However, it's still not completely unknown. And if an employer furloughs its employees down to 0 hours for longer than 10 days, it's really the best practice to offer those employees their accrued paid time out. So keep that in mind. Although because of the shutdowns, some clients don't even know if they laid off or furloughed their employees, but we can talk if you have specific questions on that. With layoffs, termination obligations absolutely apply. There's the notice to the employee as to the change in relationship, Form 2320. You want to give them the unemployment benefit information, the final paycheck on the last day worked, and this includes accrued vacation time, business expenses to date. Paid sick leave is not considered a wage, so that's not paid out upon termination. COBRA notices, health insurance premium notice. I'm going to just touch on the WARN Act because I think we have quite a few businesses on the line that are much larger, but just be mindful that there is the Federal WARN Act notice requirements, and the WARN Act requires advanced notice to your employees prior to a plant closing or a mass layoff. And then California specifically has the WARN Act, and Governor Newsom issued the executive order saying that businesses with more than 75 employees require giving workers the 60 days notice before a mass layoff, relocation, or termination. The governor suspended that portion of the WARN Act, effective as of March 4th. So You're exempt now from that 60-day notice requirement, but the new standard is that the business must give the employees as much notice as is practicable and provide a brief statement of the basis for reducing the notification period. He basically said, because of the need to prevent or mitigate the spread of COVID-19, employers have had to close rapidly without providing their employees the advance notice required under California law. So keep that in mind. With furloughs, be mindful that reducing an exempt employee's salary may bring them below the necessary salary threshold. So for your non-exempt employees, you can certainly schedule them for fewer days or fewer hours without liability concerns. You do not need to pay them for time not worked unless reporting time pay applies. With your exempt employees, it's a lot more complicated. If you have an exempt employee, let's say making $90,000 a year, they're working, on average 40 hours a week, full time, and you cut them down to half. You want to bring them down to 20 hours a week, and therefore you divide their salary by half. They then, at $45,000, they've fallen now below the minimum salary threshold. And we recommend reverse engineering them into an hourly rate and paying that hourly rate, but at that same time, keeping track of their breaks, keeping track of their lunches, and also paying overtime, actually, if they work more than 8 hours in a day. But in general, if an exempt employee performs any work in the week, again, they must be paid in full for that week. If no work is performed, no salary is owed for that week. And then you do want to provide advance notice to any reduction in schedule or pay. And then when you discharge, lay off, or give a leave of absence, California law requires employers to give written notice of a change in relationship to any employee who is discharged, laid off, given a leave of absence, or whose status changes from employee to independent contractor. Please do not do that, though. I have lots of webinars that you can watch on how you should not want change someone from an employee to an independent contractor, but that's another topic. No notice is required if the employee quits, is promoted or demoted, if work stops due to a trade dispute, or if there's a change in work assignment or location. Although it is not required under California law, federal law provides that in some situations, including larger reductions in overall workforce, the employer must provide a written notice of the change. And then California has explicit requirements for what information must be included in any notice of change in relationship, and that includes the name of the employer, the name of the employee, the social security number of the employee, whether the action was a discharge, a layoff, a leave of absence, or a change in status from employee to independent contractor, and the date of action. I want to note here that there's no requirement that the notice specify whether a discharge was with or without cause. So California law requires notice of the change in relationship to be given immediately, and that the notice be provided no later than the effective date of change in the employee's status. Although California law does not specify a particular service method of this notice, the safest practice is always to physically provide a copy to the employee at the time of employment action. Given everything going on, and you might have employees working from home, that might be impractical. So mail can certainly be another method, or even email at this point. And let's see here. Working remotely. So a couple things you want to keep in mind if you have your staff working remotely is you have to have, or I guess you don't have to, but we would recommend a written agreement. You can say that this is only temporary, but it needs to outline the guidelines that you're looking for in having an employee work from home, right? You can even say that this is only temporary while the California stay-at-home order is in place. You want to describe who is eligible to work from home, because not all jobs can be performed from off-site locations. So it's important to ensure that the employee, the job responsibilities, and the equipment needs are all met. It's also important to lay out expectations, the start and end time, being available and responsive throughout the day, that They're still required to follow company procedures, which includes adhering to the company's timekeeping system. Or if you don't have a timekeeping system or it requires a thumbprint or something like that, we would recommend that you create an Excel spreadsheet. It doesn't have to be anything fancy, but just something that keeps track of an employee's meal periods and rest periods, because I really think that this is going to be another area where employers are hit for not keeping track of time worked adequately for your non-exempt employees. And then, of course, you want to reimburse your employees for expenses such as internet and cell phone. And that has come up a lot lately because I don't think a lot of people realize that they need to reimburse for internet usage. You have an employee who's now working remotely, and yes, they may already have internet, but there is case law that says that the employer would receive a windfall if they do not reimburse, because it would be passing on operating expenses, business operating expenses to the employee. So to be in compliance with case law and Labor Code Section 2802, the employer must pay some reasonable percentage of the employee's cell phone bill and internet. So keep that in mind as you develop your work from home employees. And then just some quick reminders, state and federal privacy laws still apply, including HIPAA. Health records need to be kept separate from personnel files. Employee health information should always be kept confidential. And then you want to create and enforce clear policies for dealing with COVID-19 and apply them objectively. And then no matter who your employment attorney is, make sure you are checking in with them at least twice a year because of the changes that keep coming down, especially right now with COVID. You want to make sure that they have a team of experienced employment attorneys behind them. All of the attorneys who work here have 10 to 20 years of experience. And then something else we offer for our clients is an early liability assessment. So if you start to get a red flag by an employee and you feel like you might be, they might be setting you up for something, it's important to do a liability assessment early on so that you know what's at stake for your business. And if anyone wants our employment compliance checklist, I'm happy to send that to you. There's 9 things that are required on a paycheck stub, review your time records, compliance with minimum wage laws, and so forth. If anyone wants that checklist, they can text HF Law to 66866 and just get on our mailing list for any up-to-date news on employment matters. I promise I don't spam anyone, but we're just doing everything we can to keep our clients and our friends as informed as possible. So with that being said, Chuck, I will turn it now over to you to introduce Lajoie.
Thank you, Cindy. Our next speaker is Lajoie McClendon. Lajoie McClendon is the Chief Operating Officer of StoneTapert Insurance Services. Lajoie has been with StoneTapert for 20 years as part of the executive management team and has many years of experience as a senior benefits analyst. All divisions of the company report to Lajoie, and she manages all areas that touch the customer within the organization. She exemplifies world-class service. Lajoie is a member of the Los Angeles Association of Health Underwriters. She is a member of Vistage Emerging Leaders Program, which focuses on the next generation of senior leaders. Lajoie serves on the board of CASA Treatment Centers, where she serves on the Strategic Planning Committee and as chair of the Personnel Committee. Ladies and gentlemen, I present Lajoie McClendon.
Thank you, Chuck, but I think you missed a couple of things. I'm also a principal, teacher, and a lunch lady during this time, which has been very exciting to be able to be home with my children and work so closely with them. I'm also excited to have all of you guys on this webinar and share a few items with you related to benefits and how we think this has impacted employers and things that you should just be aware of. of. The three items that I'm going to focus on, or the three topics, are managing the employee contributions while they're furloughed and not receiving compensation. Also, we're going to talk about the ACA lookback period and what that means to applicable large employers that have variable hour employees, as well as part-time employees. And then we're going to also talk about benefit waiting periods and what the carriers are doing to assist when employees that have been laid off are rehired. Okay, so managing employee contributions for furloughed employees. A lot of employers have decided to continue offering coverage to their employees, which I think is amazing. Eligibility has been expanded and the carriers have honored those expansions. I think that having health insurance right now during these difficult times is very important. And I know that everyone, all employees that have the opportunity to continue their coverage really values that decision that the employers have made. One of the challenges is collecting the premiums. As we know, most employers do not cover 100% of premiums. So employees are responsible for paying a percentage, whether it's 20%, 10%, 5%. There's some type of deduction that's coming out of the employee's paycheck for the insurance plan that they're enrolled in, as well as the cost for dependent care. So the most reasonable option here to collect those premiums is to allow those employees to pay their portion of the premium with after-tax dollars. Hopefully everyone, if that's what you're doing, you have set clear expectations with those employees as far as due dates. You've also implemented a 30-day grace period to give them time to make the payment. You have a system in place internally to collect those payments, deposit them, make sure that those payments get to the insurance carriers in a timely fashion. The other option is, which is a very easy, simple way, but not necessarily financially feasible for employers, is covering the full premium until the employees return to work and apply catch-up contributions. The most generous option is covering the full cost of the plan or increasing employer contributions. I'm going to focus on option one because this option is the one that's probably more practical and the solution that most employers are using. Okay. So during this time, you're collecting these payments from your employees. What happens if an employee is not able to make their payment in a timely fashion? What are your options? Can you terminate the coverage for non-payment? The answer is yes, you are. You are entitled to terminate coverage if an employee is not able to live up to their end of the bargain and submit payment in a timely fashion. So what's the next step for that employee? Most would say that employees can now apply for COBRA, but that's not necessarily true. And the challenge is eligibility requirements have been expanded for employees. So technically, there's no loss in eligibility if someone has not been able to make a payment. And termination for non-payment does not constitute a COBRA qualifying event. So your employees that are not able to make payment and losing coverage because they can't make payment are not eligible for COBRA. So what's their next option? They're going to go to the exchange. And for applicable large employers, I think this is something that you really need to think about. If an employee goes to the exchange and they apply and receive a subsidy, subsidized health coverage, it's going to trigger the IRS penalty letter 226J, which you will have to respond to. Now, you've offered coverage to that employee that's affordable and meets the minimal essential requirements. So you've done your part, but that doesn't mean that you don't have to respond to that letter. You're going to have to respond to that letter. You're going to have to explain why that person went to the exchange, got coverage, and you're going to have to prove that you offered it to them, they enrolled, they failed to make a payment. You know, it just becomes more of an administrative burden for the HR team. So I kind of like combining option 1 and 2. In reality, most prudent people will live up to their end of the bargain. They're going to pay their portion of the premium. So most employees are going to keep up with that because they want to keep their health coverage in place. So I would suggest doing a combination of 1 and 2, allowing employees to continue to make their premiums. And if you have a handful of employees that are experiencing financial hardship, or maybe they're only able to make partial payments, when you bring them back to work, give them the opportunity to catch up those contributions through pre-tax deductions. The next topic I'm going to focus on is the look back measurement period. This is applicable to ALEs, applicable large employers. As you guys may all be aware, the look back measurement period is designed to help employees determine the full-time status for variable hour employees as well as part-time employees. The measurement period is the period of time where you're calculating hours to see who's averaging 30 hours a week. You have an optional administrative period, which gives you the opportunity to make an offer of coverage or disenroll someone that's no longer eligible for coverage. And then you have your stability period. The most common measurement period is 12 months. So for 12 months, employers are calculating hours, and they want to, at the end of that 12 months, they decide, okay, this person has qualified for benefits, I'm going to make an offer, and that employee remains eligible for coverage for the remaining of the stability period, which should be exactly the same as the measurement period. So if you have a 12-month measurement period, your stability period should be 12 months as well. So let's talk about the look back period and COVID-19 and everything that's going on. We've all went into a panic when there was a state of emergency announced and this pandemic hit and the virus start to run rampant. No one really had time to think clearly about what to do with their employees. There's employers that cannot afford to continue paying for coverage because their businesses have been financially impacted by this virus. So the first thing you think, oh, okay, we have these employees, they're in this class, they're part-time employees, they've been working 30 hours a week. We need to reduce hours. These employees experience a reduction in hours, or they're laid off, but employment has not legally been terminated. So there's still an employer and employee relationship. These employees are in the stability period. So they've satisfied the measurement period. They've averaged 30 hours a week. They're eligible for their health insurance. They're enrolled. These employees should continue to be enrolled, but how many employers have actually done that analysis to see if they're terminating coverage for employees that are in the stability period? This is, I think, one of the issues that we're going to see later on, where these part-time employees who have lost coverage because their hours have been reduced, and these employees have gone to the exchange, received subsidized health coverage through the exchange, and now employers are going to be responsible for penalties for the months that these employees were not offered coverage. So my advice to you, until there's further guidance in this area on how the federal agencies are going to handle ACA and the measurement periods during this time, we have to continue to play by the ACA rules. So let's talk about benefit waiting periods. What about employees that were terminated? The relationship between the employer and the employee was actually terminated, but you've decided that you are going to rehire these employees at a later date. What options do they have with their employee benefits? Thankfully, then the carriers are being really proactive about this whole thing, and they've been proactively releasing guidelines on how to manage these situations, because they do realize that a lot of employers were forced to lay off their employees, but they also realize that they're going to rehire these employees, and once the pandemic is over, these employees are going to enroll in the plan. So a lot of the carriers have decided to waive the waiting period, which I think is great. So I'm going to go through the insurance carriers on this slide. I'm going to focus on only the major insurance carriers, the ones that provide medical coverage, because I think at this moment these are the most important. Aetna didn't release any special guidelines to their rehire guidelines. Their standard is pretty generous. So with Aetna, they're going to waive the waiting period as long as that employee is rehired within a year. Anthem Blue Cross has decided that they're going to waive the waiting period for employees that are hired prior to May 31st. Blue Shield is moving forward with their standard guideline, which is if an employee is hired within 6 months, the waiting period will be waived. Cigna is providing flexible eligibility guidelines. So they're allowing the employer to determine what those eligibility rules are going to be. So if you're with Cigna and you decide you want to waive the waiting period for those employees, it's perfectly okay. Health Net is following Anthem's lead and allowing employers to waive the waiting period for employees that are rehired prior to May 31st. Kaiser is very similar to Cigna, although they've provided separate guidelines for large groups and small groups. Essentially, they say the same thing, which is they will allow the group to define the waiting period as long as it's fair and consistent across the board for all employees and it does not exceed 90 days. As for United Healthcare has decided to waive all waiting periods for employees terminated due to COVID-19. They haven't given a time frame on it. It's just a very broad guideline saying that if you've been terminated due to COVID-19, you will be allowed to come back to the plan without satisfying a new hire waiting period. If you're curious about your ancillary carriers and how they're going to manage this, and you're currently working with StoneTapert, feel free to reach out to your dedicated StoneTapert account manager. They will be able to provide further guidance on how the other carriers are handling the situation. And at this point, I'm going to turn it back over to Chuck Tapert. I thank you all for your time today, and I pray that you all are safe and healthy during these difficult times.
Thank you, Lajoie. Thanks for that. I want to thank you all for attending, and I want to thank our panelists, Cynthia and Susan and Lajoie. Terrific job. We have additional information on our COVID-19 resource page, which is located on our homepage of our website. There's a ton of information there for you, StoneTapert.com. Again, if you have questions regarding any of the material, you can email the panelists or you can email me and I can get that information over to the panelists to answer your specific questions. I want to thank you all very much. Take care and be safe. And for those clients out there, thank you very much for your business. We certainly appreciate it. We want to take great care of you. Thank you.